This is more of a research review. The research review is going to be geared towards the recent, they had a media blast. The CDC even posted on their website. They feel it pertinent to tell people that if you have a baby too soon, within 18 months, if you conceive your second child or your third child or your fourth child. Now, autism occurs in the firstborn child all the time. So that right there should prove to everybody that this research study is completely bogus. It's a waste of our taxpayer money. And even the researchers talk about the fact that they can't explain the biological mechanism by which the timing, too soon or too far apart, second or third or so on pregnancies, that the child has an increased rate, there's an increased rate of autism in those children born within, or that child being conceived within 18 months after the previous child, or 60 months after, beyond 60 months after the previous child. So we're going to talk about, there are a couple things that we can take away. This is just me poking fun at the CDC, just a research review. So the fact that they're not going to talk to you about what was actually found in the research that could actually benefit somebody. All right, key findings: autism is associated with the amount of time between births. So they said the findings from our study can help healthcare providers convey information to their patients about the ideal timing between pregnancies. So that's what they feel would be of benefit. So we're going to go through the study really quickly here and get through this. I have to call my wife as soon as we're done, Ashley, make sure that you remind me. So here's they literally mention nothing of any significance of what a woman would want to do to enable her body to bring about a healthy child into this world. So that is my issue with this study and what the CDC actually wants to tell people. They withhold evidence or information that could actually benefit mothers. They ignore the doctors the researchers talking about what are the actual biological, what are the problems with too soon or too far apart. Why would there be an increased rate of autism in too soon after the previous pregnancy or too late after the previous pregnancy? Why would those be factors, or why would there be an association, not a causation? Why would there be an association? Now, you could say potentially that a pregnancy too soon after the prior pregnancy could be a causal issue in a child developing autism, because maybe the mother is so malnourished that her folic acid or folate levels are not able to come back to normal. That is not, though, too soon of a pregnancy after the previous pregnancy. That is an issue with nutritional or gut health or other things, or maybe even a genetic disorder that is negatively affecting DNA methylation through folate. So the linkage, they say here in the CDC site, they say the linkage between birth spacing and having a child with ASD was not explained by unplanned pregnancy, an underlying fertility disorder in the mother, or high blood pressure or diabetes during pregnancy. But watch, just wait. They say all that, but just wait. That they literally are like, we can't explain it by all these health conditions, but yet in the study, it kind of contradicts that statement. Just wait. The findings from this study can help healthcare providers counsel their patients on pregnancy spacing. Couples thinking about getting pregnant can discuss pregnancy planning with their doctor or healthcare provider. So talk to your doctor about spacing out, but not spacing it out too far between pregnancies, I guess. And we're not going to mention that, we're not going to, point out the elephant in the room, that a firstborn child can have autism, which completely blows this study out of the water. Anyways, they talk about pregnancy not being, and here we have it, Journal of American Medical Association literally emailed to me, within this week. JAMA, Journal of American Medical, publishes an online, June 9th, 2019, hemoglobin A1C levels during pregnancy and risk of autism spectrum disorders in offspring, and mothers having the highest A1C levels. All right, mothers with the highest A1C, meaning the most severe diabetes or state of diabetes, those mothers have an increased risk of having children being diagnosed with autism. One problem in this study, though, I haven't read through it all, but one problem with this study is their median middle age, they would only go up to 5 years, and over half of children diagnosed in America, according to the the published research, more than half of children diagnosed with autism in America are diagnosed with autism after the age of 5. This study right here I'm referring to on the screen in front of you, that study right there only looked at children up to around 4.5 years of age. They noticed around 2%, or only found about 2% of the population having autism, which when you look at the current statistics on autistic rates, on the rates of autism in America, we should be seeing a little over 3% of the population having autism. So this is a study that I find some issues with even there. But here's the study at hand. January 11th, 2018. So this autism spectrum disorder and birth spacing finding from the study to explore early development. So ASD risk factors identified in epidemiological studies. So these are some risk factors that we could actually take some beneficial information from and think about how could we improve maternal health, thus ultimately neonatal or infant health. So maternal fetal health conditions such as diabetes, preeclampsia, infection, preterm birth, maternal exposure such as medication use, environmental pollutants, which I always say when you mention environmental pollutants, you should add in their vaccinations, GMO crops, glyphosate, different things like that, and then folic acid deficiency. We are not deficient though in folic acid, we would be deficient in folate. Folic acid is synthetic. Don't ever take folic acid. Though folic acid may improve notochord or spinal cord formation, it is not what is necessary for complete and true healthy neurological development is folate. And then if you do have problems with methylation, you need to be taking methylfolate. So it's short for, that's the short term. So short birth spacing and inter-pregnancy interval, IPI, that's inter-pregnancy interval. So how long between the last pregnancy to this one? An established risk factor for adverse perinatal outcomes. So inter-pregnancy interval is an established risk factor for adverse perinatal outcomes, including preterm delivery, intrauterine growth restriction, neonatal intensive care admissions, and is thus also concerned for potential long-term child health effects such as autism spectrum disorders. So why would the spacing of pregnancies be a risk factor for poor outcomes in the child, such as ASD or other health outcomes like uterine growth restriction, intensive care admission, those things? Well, unplanned pregnancies, sometimes the mother's engaging in lifestyle factors that are not necessarily the healthiest for both her and baby, those types of things. Sometimes mothers who stop breastfeeding or cannot breastfeed, their body goes into cycling again. They start to ovulate again sooner than a woman who continues on with breastfeeding over the long term or can. And again, this is not, I always feel like, and I got to mention it, my heart breaks for the mothers that have a difficult time breastfeeding. It is a very stressful job and thing to do there, breastfeeding. So I commend all those mothers out there that stick with it, do their best, try as hard as they possibly can. My heart breaks for those who can't. So that being said, typically the body's going to wait until the body is healthy enough, baby's weaned off some, so then the body can say, okay, now I can feed another child growing within me. So these are reasons why there would be poor health outcomes if you had a baby, the pregnancy too soon after the prior pregnancy. So in overall health would affect almost any health outcome, including ASD. But it's not the spacing necessarily, except for maybe that result of malnutrition or poor health choices. The sample for current analysis was necessarily limited to second and later births. So they only analyzed second or later births, which then you want to point out the fact that given the issue of firstborn children having autism, spacing is not the issue. It's other factors that would determine the spacing or lead to poor spacing. It's a play on words. You just got to, why is it too soon? Unplanned pregnancies, other health issues, and why too long? Typically fertility problems. and then all of a sudden an unexplained birth. So the results of the study are sampled children with ASD and developmental disabilities. The ASD is autism spectrum disorder, DD is developmental disabilities. There will be another abbreviation, which is ID, which is intellectual disabilities. So these are all different types of diagnoses. We're more likely, so these conditions, developmental disability and ASD, autism spectrum disorder, were more likely than the mothers, okay, more likely than children in the control group, POP is the control group, to be male. So if spacing was the issue, it would be the same male and female. If it was the cause was spacing, purely just spacing, then you wouldn't see a male to female ratio that was off. You would see an even ratio. So that's another clue that we understand that spacing is not the true issue here. To have been delivered preterm, their mothers were less likely than control mothers to be non-Hispanic, white, or to have completed college. They were less likely to have completed college, have lower education, those types of things, which sometimes does relate on population-based, analysis, that they would have poorer health outcomes or poorer health choices ultimately. But there are some people who never go to college, and I tell you what, they live a healthier lifestyle than I do. So that is not to say that it's, college at the time of their births, and were more likely to have had hypertension during pregnancy. So all of those things. So if the child had ASD, autism spectrum disorder, and developmental disabilities, their mothers were less likely to be non-Hispanic. They were less likely to have gone through college. They were more likely to have hypertension, high blood pressure during pregnancy. So they're more likely to have health conditions or factors that are associated with poor health choices. Except for the race. And again, ethnicity wouldn't be a factor here if it was purely spacing. Then there wouldn't be a discrepancy in race. Mothers of autism spectrum disorders children were also more likely than mothers of control children to have had infertility disorder diagnosis, and were less likely to report trying to get pregnant. So if they weren't trying, so if a mother was trying to get pregnant, then likely the mother and husband are engaging in a healthier lifestyle. This is a good time for us. There's less stress in our life, things like that. So they're trying to get pregnant. So better outcomes when you're trying purposefully to get pregnant, because in that time of life, you're more likely to be making healthier choices. Meanwhile, unexpected pregnancies may occur during times in life when people are engaging in less healthy choices. So developmental disability, mothers were more likely than control mothers to have had diabetes during pregnancy. Over 2/3 of the ASD children and about 1/4 of developmental disability children also had intellectual disabilities. So just the statistics there. Now, possible hypothesis, and this is where we can take something away that the CDC really doesn't. CDC just says, talk about the timing. Well, the timing could be right for you to conceive. My children, all right, my second Magnolia, my third Ren, they were both conceived within 18 months. It was like my wife cycled one time and we're pregnant again. My poor wife, some of you are thinking. But literally breastfeeding the entire time up until supply started to dwindle or become non-existent once becoming pregnant. But again, we were conceiving within 18 months, So in essence, if I was to fall for this idea that poor spacing, timing of pregnancy was the issue, not the choice, you guys understand hopefully by this point in time, there are other things that would make spacing associated with autism. So possible hypotheses that have been put forth. Explain association between ASD and short IPI. Include nutrition depletion from previous pregnancy. All right. So if somebody has a pregnancy, has a child, may choose not to breastfeed maybe, they begin to ovulate very quickly, and then they become pregnant again very quickly. They may be nutrient deficient, specifically talk about folic acid deficiencies in here. And thus, that could increase the odds of some sort of neurological developmental problem like ASD or developmental delays. So that is actually probably the only thing that you could say spacing could actually be a risk factor, all right? Particularly folic acid depletion, which plays a role in the neural development, DNA methylation, and is vulnerable to depletion by the end of pregnancy. But if it's risk, if we're consuming, when you're eating the right diet, it is a safeguard. It's putting up a guardrail. It's safer to be taking a folate supplement, a natural, not folic acid. When you look at the studies, folic acid is not the best overall health benefit. It may close the notochord, increase spinal cord, decreases in spina bifida risk, but in overall neurological development, folate is better. But again, you get that from natural sources. So I'm going to encourage natural supplementation, natural nutrition. It's a guardrail, it's a safety rail put up by supplementation. I'll tell you, when we're eating the way we were, my wife was just doing fantastic. You know what? She wasn't supplementing massive dosage. She would take it every once in a while, but really our nutrition was on point. So I had no fear there, and you don't need to. We have been birthing children since the beginning of time without supplementing with even folate. I am not discouraging the supplementation. Most women would benefit by supplementation because of lifestyle factors that derail them from really eating the proper nutrition diet to enable them to be healthy enough to absorb the amount of folate they need, to be able to get those B vitamins, all the nutrients they need. So it's a guardrail, it's a safety rail. But again, I'm truly more natural saying, you know what, if you are eating everything, you cannot overcome poor nutrition. If a woman was eating McDonald's every single day and they're just taking a multivitamin, especially one folic acid, God, I'm praying for that child right there in the mother's womb. So you cannot overcome poor diet with just a supplement. So maternal inflammation from previous pregnancy. So inflammation is a known risk factor for neurological problems, brain structural abnormalities, and different things like that. Maternal stress might be more common in short interval pregnancies. Increased risk of maternal complications during pregnancy conceived after a short, unintended pregnancy and the consequent delays in various health behavior changes. Again, so they recognize all the smoking cessation, changes in medication use. We know that antidepressant drugs and different things like that can cause developmental neurological problems in children. Initiation of supplementation. So again, unexpected too soon pregnancies, not expecting that, you didn't veer away from unhealthy practices. The unhealthy practices are the cause. But again, the CDC doesn't want to mention all those things in any of its media reports. That's what's so infuriating to me. It's not telling people the truth that would actually benefit the lives of these children. Our findings from the analysis that included potential mediator variables indicate that associations we observed between ASD and short and long IPI were not explained by unplanned pregnancy. So unplanned pregnancy alone couldn't explain it. Maternal infertility disorders couldn't explain it. Too common maternal antenatal complications couldn't explain it. Hypertension, diabetes alone couldn't explain it. But these are factors alone. They couldn't, but again, ASD mothers of children with ASD were more likely to have diabetes, developmental disability was more likely to have diabetes. Now again, I showed you in this video, I showed you the recent research here in June 9th, 2019 in JAMA showing that increased the highest degree of diabetes, mothers with the highest degree of diabetes had an increased risk of their child developing autism. So the poorer the mother's health, the poorer the mother's lifestyle choices are, the more likely they were to have autism, their child to have autism. So again, mothers of autistic children in this study here, the mothers were more likely to have hypertension. The mothers were more likely to have infertility disorders. The mothers were more likely to not be planning and trying to get pregnant. But yet they somehow say we couldn't explain it. Well, what about all those factors combined? Because all those factors there could lead to poor outcomes in the overall health of the child because the mother was making unhealthy choices or was more unhealthy herself. So that is what people need to take away from this study if we're going to benefit our society and our community in any way, shape, or form from using this study. Given evidence linking ASD to various genetic pathways for folate metabolism, there they use folate. Note it's not folic acid. And also immune function. These two areas might be particularly important for examining, to be examined in future studies. I would agree with that. We know that neurological problems through immune stimulation early on in infant life or developmental, that's why the influenza vaccination had an increased risk of causing developmental delays or autism in children whose mothers received the influenza vaccination. So again, those studies are available to us. TWD in the comments if you want the studies that I'm referencing and linking to, and I'm discussing specifically that last one on influenza. You should be able to find it. That is not linked in the comments or in the description of this video. Conclusion, our findings suggest ASD is increased in children born in second or later births after a short or long IPI. So their findings, ASD is seen more frequently in shorter or longer intervals between pregnancies. That doesn't mean that the interval itself is causing the problem. Please, please, I'm just trying to hammer and beat a dead horse here, hopefully, by this point in time in this video. Despite unanswered questions, these findings, in concert with those from other studies, can inform public health and clinical guidelines about optimal pregnancy spacing. It's not about the spacing, it's about the health of the mother. It's about the lifestyle choices people are making. It's whether we're in, I'm trying to keep it to this study alone. That is the study. If you can take away anything beneficial from that, just realize that it's sad that the CDC doesn't want to talk about the true risk factors. Rather, they just want to say, space it. Keep doing that. Yeah.